Today I want to talk with you about leukemias. Leukemia is a cancer of the blood cells and can be classified in two ways. First, according to the cell type, that is lymphocytic or myelogenous. Secondly, according to acuity or chronicity. As a result, we end up with the following. Number one, acute lymphocytic or lymphoblastic leukemia. Number two, acute myelogenous leukemia. Number three, chronic lymphocytic leukemia. And number four, chronic myelogenous leukemia. Before I define each leukemia, I want to go back to the bone marrow and review what goes on there. It all starts in the bone marrow. In the bone marrow, there are cells known as pluripotent stem cells. These cells provide a progenitor myeloid stem cell. Neutrophils, eosinophils, basophils, and monocytes are derived from the myeloid stem cell in bone marrow. These cells circulate in the blood. The pluripotent stem cells also provide the progenitor lymphoid stem cell. Both T lymphocytes and B lymphocytes originate from lymphoid stem cell in bone marrow. These cells migrate between blood and lymphatic system. T lymphocytes mature in the thymus and B lymphocytes mature in bone marrow. T lymphocytes differentiate into CD4 helper T cells, which trigger the immune response. T lymphocytes also differentiate into CD8 cytotoxic T cells, which facilitate cell-mediated immune response. The B lymphocytes differentiate into plasma cells, which produce antibodies. Leukemia is affecting either the lymphocytes, in which case it is called lymphocytic leukemia, or it's affecting the myelocytes, in which case it's called myelogenous leukemia. There are therefore two types of acute leukemias, namely acute lymphocytic or lymphoblastic leukemia, which is abbreviated ALL, and number two, acute myelogenous leukemia, which is abbreviated AML. And there are two types of chronic leukemias. Number one, chronic lymphocytic leukemia, which is abbreviated CLL, or chronic myelogenous leukemia, which is abbreviated CML. The cause of leukemia is not fully known, but there is evidence that chromosomal defects are involved. Here is a general clinical presentation of both acute lymphocytic leukemia and acute myelogenous leukemia. Number one, they both have acute onset of symptoms and may have similar presentation even though they are different diseases. Number two, patients are susceptible to repeated infections due to neutropenia. Number three, patients will have easy bruising, bleeding, or petechiae due to decreased platelets. Number four, lymphadenopathy, splenomegaly, and hepatomegaly may be due to infiltration of leukemic cells. Number five, patients may present with bone pain. Number six, in acute lymphocytic leukemia, it is more common in children, and acute myelogenous leukemia is more common in adults. Number seven, patients may present with weakness, fatigue, fever, night sweats, and weight loss. Number eight, patients may present with neurologic defects. Number nine, patients may present with hyperkalemia, hyperuricemia, and hyperphosphatemia. And number 10, horror bodies are present in acute myelogenous leukemia, but not in acute lymphocytic or lymphoblastic leukemia. Here are pictures of both acute myelogenous leukemia and acute lymphocytic leukemia. Note the abnormal size of the lymphocytes and the myelocytes. Here are some general clinical presentations of chronic myelogenous leukemia and chronic lymphocytic leukemia. In chronic lymphocytic leukemia, number 1, patients may be asymptomatic at the time of diagnosis. Number 2, patients may have painless lymphadenopathy, especially in the neck. Number 3, patients may have hepatosplenomegaly. Number 4, patients may have recurrent respiratory and skin infections. Number 5, patients may present with fatigue, weight loss, easy bruising, bone pain, skin rash, and abdominal pain. Chronic lymphocytic leukemia, CLL, is the most common form of leukemia in adults in the Western world. Hypogammaglobulinemia is common in chronic lymphocytic leukemia. In chronic myelogenous leukemia, number 1, patients may be asymptomatic and the diagnosis is made from routine labs. The onset phase is very slow. Number 2, chronic myelogenous leukemia can evolve into acute myelogenous leukemia. Number 3, patients may present with fever, night sweats, anorexia, weight loss, and recurrent infections. Number 4, patients may present with easy bruising, bleeding, and petechiae. Number 5, granulocytes are predominantly affected. And number 6, Philadelphia chromosome is associated with chronic myelogenous leukemia. And here is a display of the chromosomes indicating the Philadelphia chromosome at number 9 and number 22. Here are two histologic presentation of chronic myelogenous leukemia and chronic lymphocytic leukemia. Notice the abnormalities of the cells. How is leukemia diagnosed? The diagnosis is established by blood, bone marrow, biopsy, and peripheral smear. In acute lymphocytic leukemia, there is greater than 20% of blast cells from the lymphoid lineage. In acute myelogenous leukemia, there is greater than 20% of blast cells from the myeloid lineage. Or rods are present in acute myelogenous leukemia. In chronic myelogenous leukemia, there is leukocytosis with elevated immature eosinophils, basophils, and neutrophils. Philadelphia chromosome is present in chronic myelogenous leukemia. In chronic lymphocytic leukemia, there is lymphocytosis and infiltrating leukemic cells in the bone marrow. How is leukemia treated? Acute lymphocytic leukemia and acute myelogenous leukemia are treated as follows. Number 1, high-dose combination chemotherapy for several weeks. Number 2, blood transfusion. Number 3, platelet transfusion. Number 4, antibiotics. And number 5, bone marrow transplant. More than 75% of children with acute lymphocytic leukemia achieve complete remission. In acute myelogenous leukemia, it is more difficult to treat and does not respond very well to chemotherapy. Chronic lymphocytic leukemia. Asymptomatic patients are observed. Treatment for symptomatic patients are age dependent, and young people can receive fludarabine or rituximab, and older patients receive ibrutinib. In chronic myelogenous leukemia, imatinib was developed to treat this form of leukemia, which is chronic myelogenous, and stem cell transplant is an option for chronic myelogenous leukemia. Well, thanks for watching this short overview of leukemia. I do hope it provided a platform on which you can build an understanding of this very important topic. Please don't forget to like, share, and subscribe. I wish you well. Good night.